I've gotten comments before or talked to patients before who have just had it. They feel like they can't get their glaucoma under control and they're really frustrated with the whole treatment process and they feel like they're going to lose their vision. So they give up and they just stop using their drops. But that is the absolute opposite of what you want to do. I know a glaucoma diagnosis can be overwhelming. We're going to talk about some of the troubles we can run into, but I also want to give you some tricks and tips to deal with these overwhelming feelings, the frustrations that can come along with a new diagnosis. I'd like to offer some ways to reframe and cope with the situation. First of all, it's important to remember that we're not going for perfection here, okay? Imperfect treatment is better than no treatment at all. So if you're having trouble getting your eye drops in exactly when they're supposed to be on the schedule, or you miss occasionally, it's okay. It's hard to get everything exactly right, but getting frustrated and overwhelmed with the process and quitting the drops altogether will just cause your eye pressure to go up and will lead to progression of vision loss without a doubt. There are many people out there experiencing something similar. About 3 million people have glaucoma in the US alone. I believe there are things you can do to turn this heaping plate you've been given into bite sizes to help you take this head on. Let's talk about some of them now. Here's the problem. A diagnosis of any kind can be scary. There's the fear of progression, fear for the future, fear for the need for surgery, fear of the other things I'm about to mention in a little bit, and fear of more doctor's appointments, more time spent away from doing the things that you like and sitting in a waiting room. Here are some tips to help with dealing with an overwhelming diagnosis. First of all, seek support. This could be from family, friends, glaucoma support groups that are online or in person, and I'll put some links in the description below. Counseling, therapy, and even your pet. Talking out loud can help to get something off your chest. And though they might not talk back, I am confident that they'll listen without interrupting. There are also concerns surrounding the treatments. When we treat glaucoma, we start with eye drops, and this can be difficult for some people. It's a lot to keep track of, and it can be easy to forget. Also, there's the possibility that multiple drops may be needed, and that can create a difficult eye drop schedule that just seems overwhelming. There's the concern about maybe developing side effects, or maybe you already have side effects and you don't know what to do. And not to mention, some drops can be really expensive. Yeah, there are a lot of different options, but not all generic or inexpensive drops work for all people. And the more drops you're on, the more likely you are to have side effects. And when you have side effects, usually certain eye drops that are preservative-free or special in some way would be recommended, but those can be more expensive than the other eye drops. So what can you do? As far as managing the eye drop schedule, for me, it always helps to be organized. Ask your doctor to write down the names and times that you need to take the medications so that you can create some sort of schedule, whether it's written in a calendar or making a list of alarms on your phone if you like to use your smartphone. That is a great method to keep track of these things. I would recommend keeping the drops somewhere in plain sight where they're right in your face, you can't miss them. That way, every time you walk by, you remember, okay, my drops are coming up sometime soon, and you won't forget. Try to keep that area clear of clutter so they stick right out. You don't want them to get lost among the mess, and you want to definitely keep them away from the super glue. Believe me, I have seen it, and you do not want to mix those two up. What always helps me is to create systems. Once I had kids, I felt like there were so many towels and bibs and I didn't want to walk to the laundry room every time, so I put a can in the kitchen so it was accessible and I could use it when I needed to do laundry. That really helped make some small little change. I created a tiny little system to make my life easier, and you can figure out a way to do that with your drops too. Ask your doctor to explain the side effects and give you resources to learn more about them later. There are so many, and it's usually more so the common ones or the more dangerous ones that are discussed, and they're also really hard to remember. So this will just help you to keep track and know what to look out for. If you're concerned about cost, let your doctor know. Ask them if there's a generic available versus the brand medication. Also ask if there are any patient assistance programs through the pharmaceutical company or otherwise, or perhaps reach out to your local Lions Club for assistance. I'll link some resources in the description below. It can be especially troublesome if you're struggling to find a doctor in your area, or maybe you have found a doctor but they don't take your insurance. That can be so stressful. And sometimes eye doctors have really long waits to get in for an appointment, and then you're worrying about your glaucoma progressing during that time period. Or the doctor has appointments available, but you have to sit in the waiting room for what can be up to hours. That's so tough to manage. It can be difficult to find a doctor that you trust. And if you live in a rural area, you may have to rely a lot more on your primary eye care provider rather than a glaucoma specialist who take care of typically the more severe glaucoma cases. And there's no real way around that. If there's no one available, you may have to travel for procedures. But if you do live in a larger city or a place with more options, you're having trouble finding a doctor, let's say you found one or your eye doctor referred you to one, but they don't take your insurance, it can be really confusing what you're supposed to do. Well, I would recommend doing a little research. You can ask around, you can even ask your other providers, not just your eye care provider, and look online. Sometimes I find this to be really overwhelming. Looking for doctors in your area and knowing who's going to take your insurance is just a lot to figure out, and it can be stressful. So for myself, when I'm trying to figure stuff like this out, I like to break it into pieces. Just take a day where you do the research, write down names and numbers, and then call maybe one doctor a day and just do it one at a time to ease the burden. When you call them, if they say they don't take your insurance, you can also ask the receptionist if they have any other recommendations. Who do they tell people to go to if they don't take their insurance? What are other options? Do they have patient assistance programs or payment plans? There are usually ways around it, and it's really important to get care because if you don't, you may lose vision. So it's important that they help you along with this process. You can always reach out back to the doctor who referred you, let them know that your insurance was not accepted, and ask them what to do. Your vision is important to them and they should be willing to help. I'm no stranger to long waits at the doctor's office, and I've been on both ends of it, and it's really not fun for anyone. But I've had some patients who have a really positive attitude about it, whether they're driving from far away for their appointment or they expect to be waiting a long time. What they'll often do is they'll make a day of it. They'll go to breakfast, they'll go to lunch, they'll bring a book or other entertainment or a loved one to talk to. And I would always recommend having a loved one with you anyways, because they can help to be there to support you if you happen to receive bad news. They can also help you to remember questions to ask the provider and to help you take notes and write down what the doctor says regarding the treatment plan. That way you can really focus in and listen while they do the note taking. Speaking of that, I would always recommend writing down questions ahead of time. And there can be so little time with the doctor that your mind goes blank, only to start racing as soon as you walk out the door. Writing down those questions ahead of time will help you to ensure that those get answered, and they can really take a lot of the stress out of the appointment day. Maybe you've already lost vision and it makes you want to throw in the towel, but please don't. That will only make the glaucoma progress even further, causing further vision loss. If you've already lost vision and you feel like you just want to give up, keep in mind there are options there too. There are low vision rehabilitation specialists who aim to maximize the vision that remains. And they do this using magnifying glasses, telescopes, special glasses, multiple pairs of glasses of various powers, and there are a lot of electronic options as well. So there are often ways to utilize the vision you have remaining to help you maintain the highest quality of life that you can. It may also be worth considering a vision loss support group. Meeting others who are experiencing something similar to you may help you wrap your mind around this new life experience and figure out how to navigate it. I would also encourage you to learn about the experiences of others who are blind or visually impaired. I've been watching videos of a young woman named Molly Burke who went blind at a very young age. It's incredible to hear about her experiences, watch her travel and witness the world through touch, and witness her positivity and love of life. I completely understand if this message falls short. Your experience is your own, and you may be sick of everyone telling you it's going to be okay. I can't promise that it's going to be okay, but I can tell you that gaining a greater understanding of the diagnosis and understanding the treatment can help you to feel a greater sense of control of the situation. If you're still sad and struggling, that completely makes sense. I just hope you don't give up. To learn more about glaucoma treatment options, click here, and these will give you more background about glaucoma. Thank you for watching, and I wish you the best.